It is my pleasure now to introduce Dr. Margot Sunderland, who is the Director of Education and Training at the Centre for Mental Health in London. She's also the co-director of Trauma Informed Schools UK, the honorary visiting fellow at London Metropolitan University, a child psychotherapist with over 30 years of experience of working with adults, children, teenagers. Margot is the author of over 20 books in the field of child mental health, which have been translated into 18 languages and published in over 24 countries. She is passionate about social change for a kinder, warmer world. Conference, I give you Margot. Thank you.
Thank you so much, Kima. Okay, I'm just going to share screen a minute. Here go. Okay,
doing the tech stuff. Thank you, Margot. Just a reminder for the chat room that we'll kind of quieten the chat room as your slides are coming up. And is it all right if I give you a 5-minute time check, Margot?
Yeah, absolutely fine. Yeah, are you? Can you see that okay, John?
That's come up really clear. Looks lovely, Margot. Thank you.
Good.
Great.
Okay, so just to say that you will get the full text of what I'm saying, and there are a few key slides that John's going to put in chat, hopefully. And we have permission to show some clips because we are Trauma Informed Schools, which I'm one of the directors, is a member of Education Recording Agency. So schools are being fed two deeply concerning messages about how best to support pupils and students who are in psychological pain. The two main models are the psychiatric disorder and chemical control of children model, and the second one is learn to manage your feelings. And as I'm going to present, both of these are failing children and young people dismally. So lots of courses for mental health leads. I'm not going to mention them in case I don't want to be sued, but basically they are learn to spot the symptom, the disorder, the illness, and refer on. Well, refer on, that's crazy when we have in some areas 2 to 3 years waiting list for CAMS. But so let's look at that first model. So many teachers know, right, okay, spot the symptom and spot the disorder like ADHD and refer on. Well, when a child or teenager is given a diagnosis, people stop thinking. And look at the chemical control of children. So last year there were 75,000 prescriptions for Ritalin. And we see in this country 83.4 million antidepressant drug items were prescribed. The math doesn't add up because of repeat prescriptions. There are only 68 million people in the country. And yet, and Joanne Moncrief will be speaking about this, they've found that, you know, in the public arena, people really do think it's about chemical imbalance. In fact, 90% of people think depression has got nothing to do with psychological pain, but to do with serotonin. And yet Moncrief's wonderful research shows that there is no difference in the serotonin levels in people diagnosed with depression and healthy controls, and no difference in the serotonin transporter genes between people with depression and healthy controls. So the abuse of giving someone, particularly children and young people, a psychiatric diagnosis and medication without ever hearing their story. So I'm going to play now, Rachel, I'm just going to go back a minute, yeah. Rachel is in care, an inpatient. It costs 230,000 a year to be in an inpatient in CAMS, and she's been diagnosed with emotionally unstable personality disorder, and no one has ever heard her story. But when you hear Rachel, you'll see, you know, she's desperate. She just wants someone to hear her story, and no one has ever done that.
How many times you tried to kill yourself?
In my life or in the past year?
Both.
In the past year, easily 50, 60 times, probably. In my life, 80.
Why?
There's a lot of reasons.
Growing up was normal, tricky, a lot going on.
A lot going on. Yeah. I personally think that there's things that have caused my EUPD in my past. I think if you have a troubled childhood, a lot of the time it can lead to it. Things like your parents maybe not getting on, maybe having a parent that will say negative things to you, so that you don't have that support as a child. You know, if you're told things as a child, it sort of sticks into your head, and then so you'll grow up kind of feeling that way.
Is being here helping you?
No.
What do you think would help you?
I think therapy, to be honest, definitely, because I've never had therapy before. I've never spoke to people about any of my past, and I think that's probably what's needed.
That's not been offered here.
Well, they have got a psychologist that comes once a week, but she's been off sick, so no, at the moment nothing.
But there's no one here to replace her while she's not here?
No.
You're saying a lot went on when you were younger, but you've never spoken about that
No.
to a professional?
No.
So yeah, there's every chance that would really help potentially.
Psychiatric diagnosis and medication don't heal children, and yet we have a tsunami of research, psychology and neuroscience about what does heal children and how people recover from trauma. So what are we doing giving out diagnosis and medication without ever hearing a child's story? In my view, it's tantamount to emotional neglect. Most schools and many CAMS services have no evidence-based theory of transformational change and trauma recovery. Instead, we just have symptom control. It is time we do our homework. We know from Judith Herman, from Bessel van der Kolk, from Gabor Mate, and a tsunami of neuroscience research about how people recover from trauma. And yet people like Rachel never get that knowledge and never get someone implementing that knowledge. They're just given symptom control, which is emotional neglect. Beautifully put by Asen. If a plant were wilting, we wouldn't diagnose it with wilting plant syndrome. We would change its conditions. And way back in 1943, Maslow looked at how people become utterly in pain, in psychological pain, when these needs are not met. And that was 1943. And now, after that, endless research to back up what he said in neuroscience and psychology, called the social buffering studies, that if a person feels validated, if they feel connected, if they feel they belong, then that terrible pain, which I was trained by Jaak Panksepp, you know, there is in psychological pain a terrible opioid withdrawal in the brain, but all of that is alleviated with connection and validation. And if we don't do that, yes, people are going to be in terrible psychological distress. So why is it that we don't say to schools and CAMS services, well, how are you meeting this young person's need for belonging, for social, feeling worthy, for feeling validated, for giving hope? Because all of these at the moment, feeling isolated, we put young people miles away in CAMS inpatient units, way away from their families, and isolate them and think they're going to get well. So all of these will come out of not addressing those conditions that like the plant needs and human beings need. If we don't have those conditions for connection and validation, you know, we are going to feel absolutely awful. And that is before any overlay of trauma. So many communities are addressing these needs brilliantly for young people. And research shows that community work is as effective work with psychological treatment one-to-one. So I'm just going to play this little bit about a crisis cafe for young people.
When I was first approached about it, I was actually quite shocked. I'd never heard of anything like it. I had never heard of something that was youth-led and actually talking about mental health instead of being talked to about mental health. And it was an opportunity to really take back our future and really talk about these issues.
The year that we've had, I was really struggling to balance school and balance friends and everything whenever I couldn't even leave my house, like with more than 6 people. I was just struggling mentally, and I heard about the Crisis Cafe. It provides clinical help in a non-clinical environment, and it really helped me manage like my life over the past year, helped me get everything in order, keep my mental health straight.
For years we've been hearing the same thing really, that young people can't access services when they need it. We know there's a mental health crisis in Northern Ireland, but actually many of those young people never access services. So our goal here is really to overcome barriers that people can access the service when they need it, but reducing stigma, and we're seeing that already, that young people feel that it's okay to come here, they're encouraging their friends to come who need support, and that really is reducing stigma.
Okay, so my premise is this: until all mental health workers can answer the following 2 questions accurately, there can be little hope of positive change. Question 1, what's happening in the mind, body and brain when a person is in ongoing psychological pain? Question 2, what evidence-based relational interventions are you using to alleviate psychological pain in ways that bring long-term transformational change for mind, body and brain, rather than just symptom control? And the tragedy is that a great many CAMHS services and a great many schools could not answer those questions because there's a kind of not acknowledging and embracing that mental pain, what we call mental health problems, are based on psychological pain, and we need to address pain, and we need to know how people recover from pain. And so there's this weird kind of going up a blind alley of diagnosis and medication. And we know that healing through relationship will profoundly impact on, and this is long-term change, brain chemical profile, brain structure, and body physiology. And so we are in Trauma Informed Schools UK, we're working in we've got practitioners in over 5,000 schools, and we have had training for over 20,000 school staff, and we've seen remarkable change when people have core skills in so many young people, and that is empowering school staff with core skills in active listening, in what best parenting and narrative competence. So CAMHS inpatient units look after about 4,000 young people a year, on average 230,000 per person a year. The cost of CAMHS community support is 30,000. And since 2019, 46 patients have died on the ward or within a year of leaving a CAMHS inpatient unit. One patient spent the day planning how she would self-harm. The whole day I would just think, what should I do today? What method should I do? Patients organizing collective self-harming. Chelsea, age 15, who took her own life on a CAMHS ward. She was in multiple CAMHS wards for 2 years. Her mental health deteriorated. She learned dangerous methods of self-harm, putting her life in danger 250 times in 18 months. The coroner said she had seen no evidence of attempts by staff to address with Chelsea why she helped self-harmed. In other words, hearing her story. And so spot the symptom and refer on. Between 2020, 2001, 500,000 referrals to CAMHS. And and often then at the end you get 6 sessions of CBT or medication, or you're turned down. So we have to have a different model, and that's what we're doing in schools. Okay, so supposedly we have 1 million children and young people who are in mental distress at the moment. So having a counsellor coming in to see just a few a week is just not going to deal with that. Lord Layard at a recent conference, when head of a big counselling service said, we see 23,000 children. He said, madam, that is a drop in the ocean. We have 1 million children. We need an army. So what our work in trauma-informed schools is doing is absolutely supporting school staff to be that army and to be emotionally available adults. So we know all the social buffering studies show that one emotionally available adult before the age of 18 can interrupt the trajectory from childhood adversity to ongoing mental health issues and serious trauma. And this was in the government green paper. There is evidence that appropriately trained and supported staff, such as teachers, school nurses, teaching assistants, can achieve results comparable to those achieved by trained therapists in delivering a number of interventions addressing mild to moderate mental health issues like anxiety, substance use, post-traumatic stress. And we're not saying don't refer on with, to a trained psychotherapist with severe mental health, but this is mild to moderate, which so many of them have. So what are we doing? What are those core skills? Which is a model which works rather than psychiatric medication for refer on and diagnosis. So I'm going to pick up a quote by one of my heroes, Sami Tamimi, who actually was sitting next to Lucy Johnson at a conference in early intervention service in Wales, where a psychologist stood up and said, what are we going to do? We have such a shortage of psychological therapists. And he said, madam, I don't think there's a shortage. We are just not using them. And I don't know if Lucy remembers this, but Lucy and Sami then, Lucy said core skills, absolutely, core skills. So we give teachers and teaching assistants core skills in how to become an emotionally available adult, and people get well. And we have seen this as time and time again in our schools. It is not about asking school staff to be quasi-psychotherapists. It's about replicating in schools what's happening in best parenting, good listening, mental state talk, affect labeling. All of these have a neuroscience backing about how they support recovery from trauma. And the one thing parents don't do, of course, is training in narrative competence. So we do that. We support our practitioners in schools, our teacher, this army, to be narratively competent. In other words, how do you listen to a child's or young person's story? Just listening with acceptance and not judgment. Felici found that 130,000 people talking about their painful childhood experiences reduced GP visits the following year by 35%, and emergency visits were massively reduced. And again, there is all the backing about this, that feeling understood results in people feeling valued. It triggers the reward centers in the brain. So if we just listen for a clip now of a young person who was on a CAMHS waiting list, didn't work, didn't meet the threshold, and then she met someone who listened to her story and she felt understood.
I would self-harm, and that turned into a coping mechanism for everything. If I was sad, I would self-harm because, I felt like I needed to punish myself. At the time, it felt like it was a relief, and then afterwards I felt like I was a failure for doing it and giving in. I'd developed bad eating behaviours and restricting and bulimia. During COVID, because there was nothing else going on, it was all I could think about. I was referred to CAMHS by my GP. Personally, I didn't fit in the bracket of the right way. So it was kind of like I wasn't at the crisis point for them.
Did you feel that you were dismissed?
Yeah, I felt like I wasn't ill enough for them. And then I got help, the help that I needed.
So the mental health service did refer you to
Safer, who were a local charity. When I opened up to the right people, I gained, that support, and, even just one person sat there and listened and said, I understand. And that felt just amazing because, I'm not on my own here. Someone else can empathise and feel what I'm feeling.
One of our practitioners, Maisie, she would in normal circumstances be diagnosed with anxiety disorder and depressive disorder, but in fact had one of our practitioners. She went from 8% attendance to 88% attendance. Just learning about active listening and empathy. This was one of the texts. Miss, I'm finding it so hard to come to school this morning because my body feels crazy and I can't stop shaking. I don't know how to make it stop. It's like I'm furious and alone and wanting to cry all the time, and my brain can't decide which. Oh, Maisie, how painful this must be and how frightening. I'm so sorry you feel so overwhelmed. Just too much, eh? That's right, Miss, it's exhausting. You are in my mind and my thoughts, dear Maisie, and I will see you at break if you come in. Thanks, Miss. Maisie came in, and Maisie was no longer anxious at the end of this relationship, which is all proven by all the research on social buffering, and her attendance went up to 88%. So we know, and this will be on your handout, how people recover from trauma. And stage 2, the retelling, the story of the traumatic event and grieving is absolutely key. So as Lucy says, supporters of psychiatric diagnosis say, we don't have alternatives. The alternative is to hear people's story. So we train people in narrative competence. And this is having the courage to bear witness, to stand with the person in the glare of their pain, honoring the need to tell. Sally was diagnosed by Maudsley Hospital as having ADHD and put on Ritalin. After her parents split up, she'd become agitated and aggressive. No one had ever asked her what it felt like when her parents split up after she witnessed marital conflict for years. She was given chemical control for her behavior and diagnosis, but nothing helped. So her mother eventually put her in residential care. Look how profoundly able she is to, if someone had talked about her story, how profoundly able she is to talk psychologically. When Sally wrote to her mother from residential care, I shall die now because by sending me away, Mummy, I have only half my heart. The other half is with you. And I saw someone similarly and similar background, diagnosed with ADHD, and I listened to her story and I said, would you show me what it's like, what it was like? And because with children and teenagers, we use a lot of artwork. So we use sound play and give it a title. And she said, this is volcanoes in the kitchen. And we use some of my cards, which are helping teenagers talk about their lives and helping people talk about trauma. And it just helps with affect labeling, because we know in a lot of people who are in pain, part of it is because they've never put words to feelings. She chose this card, which is all about shock. And she chose these cards, what else is going to crash land in my life, living among the broken people. And through all the work with me, she no longer has, technically an HPA hyperactive axis, which we know is, when people suffer from trauma, they're stuck in this hypervigilance. She's calm for the first time. She has a mind in peace, not a mind in torment. So how long do we leave a teenager with a confused, untold story? A day, a year, a whole school career? we've found that some people say, but isn't, some teachers, of course, because they've never done their own personal work, say, isn't this all going to open a can of worms? And our response is, left alone with a can of worms, we abandon them in their suffering. And what we found most interestingly, that the people who are worried about can of worms have never really addressed their own emotional pain. And the ones who have, they aren't worried about that, and children just go on and fly. So emotional pain, we can medicate it, we can defend against it, we can use coping strategies because that's what they are. Or we can feel it in the presence of someone who stands with us in the glare of their pain, honoring our need to tell. But only the latter brings trauma recovery and transformational change. The former bring temporary relief. So going back to our model, the second one. So the first one doesn't work, we know. The second one, learn to manage your
Just a little time check, Margot. Sorry to interrupt you.
Yeah, yes. That's fine. Yeah. The learn to manage your feelings model. And the word manage, I once looked at all the PSHE materials because I was asked to by the National Children's Bureau, and the word manage came up. Rather than learn, feel your feelings in the presence of someone can help you grieve and help you make sense of them. The word manage, well, that is symptom control. No one gets better from symptom control. Kate Middleton, she says, addiction could be avoided by teaching children to manage their emotions. I'm afraid she hasn't done the neuroscience or psychological research. You cannot get well from managing your emotions. Mindfulness doesn't work. Well, of course, no, it doesn't, because it's symptom control, not trauma recovery. Trying to manage your pain with things like positive thinking, exercise, mindfulness is a bit like using a bucket to stop a tsunami. You know, these are, as Pam Skep says, psychological pain is huge hormonal force. It's a huge hormonal force. You can't just, you know, do a bit of symptom control. So just to finish, one trusted, emotionally available adult before the age of 18 can interrupt that trajectory from awful adverse childhood experiences to a mental health issue. So I'm just going to finish by playing, and it will fit in the time. It might overrun 1 minute, John, but here we go.
By 8 years old, I'd been punched in the face. By 8 years old, I'd been forced to steal so I could eat. And by 8 years old, I'd been raped countless times. But I want to share this with you because I want to show you what's possible. And I mean what's possible from the point of view of a broken little girl who believes that she is completely worthless. Because this little girl went to school, and school meant everything. Now, like others, Mr. Williams asked me about my bruises, and I did what I always did and lied. But he leant into me and he said, I think you're protecting someone. And what you need to know is that I'm here to protect you. I'm here to look out for you. I will never forget his face when I told him just a little bit of the truth, pained, like my words were causing him actual pain, and he didn't say anything, but he took me to the library, and I peeked through the window and I could see him outside. He was standing there with a cricket bat in one hand, and he was slapping it like this into the other. Now, I don't have any idea what he thought he was going to do with that bat. But he stood there until a social worker came. And it wasn't the rescue that had the impact on me. It wasn't the fact that in that library was the first time in my life I'd ever felt safe. It was the fact that he showed he cared, that he stood for me. Growing up in care and on the street is pretty hideous. But I was incredibly lucky. I had 4 more ordinary heroes show up in my life. And each one of them, and they all happen to be teachers, showed they cared by holding a vision of success for me. Mr. Williams stood outside a library. Mrs. Cook held my hand when she knew the fire alarm was going to go off. Mr. Simpson asked me how I was every single day and then waited for an answer. Miss Archer valued all of my ideas, even though a lot of them were borderline bonkers. And Mr. Redman, well, he just waited for me to try. And then he stood there and smiled the biggest, proudest smile. I mean, these seem like small things, but these 5 adults enabled a broken little girl to become me. Trying, so please stop doubting that you're a hero, and stop worrying that you haven't got what it takes. You are good enough. Every day I work with teachers who they're crushed by our education system and they think that they're just ordinary and not brilliant. And it, you know, it breaks my heart because that those heroes make a difference. And if you know that in your schools and in your workplaces, your friends, your family, this is their story. It's not just my story. The details might be different, but the struggle is the same. It's anyone's story who is afraid they might just be unlovable. And in their story, you're the hero. The hero is you. So go be a hero. And it doesn't matter if you don't feel ready, and it is totally okay if you're scared, but do it anyway. Because when you do, you can literally transform a life. Thank you.
There we go. Thanks, John.
Thank you, Margot. That was so moving.